Hi, everyone. I'm Brooke Smith. I'm the CEO at United Way here in Lebanon County. Happy to join you today over the lunch hour and continue our community connection series. If you remember last month, we were happy to have Mike on board to share a little bit about connected together in the community. Today, we're going to get into a deeper conversation about adverse childhood experience. But first, I thought it would be great to take a little time and let Mike introduce himself. And Mike, maybe just give us a recap of last month's interview and some of the things that you shared to kind of piece this all together for people.
Sure. So just as a reminder, I'm the public education coordinator with Domestic Violence Intervention of Lebanon County, which is the service provider in the community for victims and survivors of domestic violence. And I also actually work part-time for an organization called Lakeside in their Lakeside Global Institute as a trainer. And this is an organization that's committed to spreading messages about trauma and resilience. And so connected together then is kind of this informal work group in the community of a variety of professionals who have come together who believe in sort of creating what's called a trauma-informed community. And we don't really call it that because there's a lot of meaning to that can come up for that. So we call ourselves Connected Together because really our vision for the community is one where kindness is a life circle. We want people to be able to come together in relationship and connection in a positive way. And a lot of that has to do with kindness and compassion.
Great. And so there's kind of 3 different project areas, right, that are part of this Connected Together group.
Absolutely. So we've kind of identified 3 goals, each one landing us into a particular project. So what we're going to talk about today is more in that bucket of trauma-informed care, and what does that sort of mean in providing that information to the community. And then we also have a group of folks working on what's called the basics, which is an approach that was developed out of Harvard University and promotes 5 pillars for parents and caregivers and really all adults in the community to be working with kids. It promotes cognitive skills, but also promotes social and emotional learning skills. And then the third project is what we're calling Neighbors United. And that will be an effort that's actually in the process of picking up now that we've gotten some funding behind it. And essentially, we're going to be able to have a staff person hired at STARK who's going to coordinate sort of recruiting community volunteers who are really the informal leaders in the community, and give them some training and education and messaging that they then take to their neighbors in very informal ways. Just, when they go to church over the weekend, just talking to their neighbors, when the kids come back from school and everybody's sitting around waiting and those kinds of things. Having these really informal conversations, but want to help folks get the tools and the skills that they need to have some of these conversations in an effective way.
Absolutely. So today, this is a topic I know that has really opened my eyes. Certainly I've worked with young children in past in my career for a long time, and the ACEs studies is something that really was just eye-opening, and understanding how experiences can affect individuals throughout their whole life in many ways. And so I'm really interested to hear more about that and have you share with our community at large to help people kind of connect the dots with some of this. So I guess today we're going to kind of start at the basics of trauma with this ACEs study.
Sure, yeah. It's a great starting point. And really the ACE study is something that anybody can know about, and really probably everybody should know about. So ACE is just right out of the gate. ACE is an acronym, and for adverse childhood experiences, and that's really, I just describe that to people like it's just a fancy researcher term for bad things happen to you when you're a kid, right? Yeah. But there were 10 categories of ACEs, or traumatic experiences, that researchers identified in this original study, which was actually completed way back in about 1995 or so. The first results get published in 1998. So it's been around for, a good 3 decades at this point, almost. And, we've learned a lot from it. And so, again, it's really something that a lot of people should know about. And, the information's out there. This isn't some secret that we're trying to hoard. People can go online and find out a lot of information. Google, the study. It was actually originally done by the CDC, so they have a whole section on their website on the AIDS study.
Mm-hmm. Yeah. Can you describe, so when you say, bad things happened to you when you were a child, what are some of the specific things that this study really looked for to link to other challenges maybe that someone might have?
Sure. So in the original study, they had 10 categories of ACEs. And it's not really important necessarily, precisely what those are, but it essentially breaks down to things like experiencing child abuse, so whether it's physical or sexual or some kind of physical or emotional neglect. We're also talking about things like, sexual assault more broadly, witnessing domestic violence in the home. So if I'm a child, we have to keep in mind this is adverse childhood experience. These are things that happen to us or around us when we're children. So I might witness domestic violence between parents or adults in the household around me. There's also things like, parental separation or divorce or death of a parent. We also have things around mental illness or substance abuse or substance addiction for adult household members, as well as household members who spent time in prison.
Yeah. So, I've heard a lot of conversations lately. We're in the midst of a global pandemic. And, help me understand and help the community understand what's the difference between those types of experiences specifically that you just spoke about versus something more at the community or worldwide level, like a pandemic, a fire, natural disaster, something like that.
Sure. So what we're kind of getting at is this big word trauma. Mm-hmm. So ACEs are really this broad category of trauma that's a kind of an umbrella term. Mm-hmm. And so when we look at ACEs or things like ACEs, we could really consider them to be something like relational types of trauma. These are things that deal with relationships. And ACEs in particular, it's important to keep in mind are our earliest relationships, children. Those relationships we don't get to choose. Mm-hmm. And so they're really, really important in that way. But then we have this other broad category that you're kind of speaking to, for under this umbrella of trauma, which is more of a situational trauma. Mm-hmm. So things like pandemics or fires, car accidents, violence in the community, terror attacks and those kinds of things, or more situations. They're environmental, if you will. And the thing to keep in mind is that it can all fall under this umbrella of trauma, and therefore the impact of that trauma can be very real and can be very serious and withstanding for people. It doesn't necessarily have to be a relational wound that causes us this trauma.
Mm-hmm. So, they focused on these specific areas for children within this study. Can you share about some of the things that they found, maybe, some of the findings that were surprising or things that were brought to light through that study?
Sure. So the original study had 2 main conclusions. The first conclusion is that it found that ACEs are incredibly common. So the thing to kind of keep in mind is this was a study that was done in Northern California, inside the Kaiser Permanente health system, which is a huge health system and insurance system out in California. They had over 17,000 people participate, which is a huge number of people. And essentially what they did was they took these 17,000 people and they assessed how many ACEs did they have. So for every category of ACE, so we had those 10 ACEs, right? If 6 of those happened to me when I was a child, child under age of 18, I would get an ACE score of 6, right? So basically a questionnaire, one question per age. And then what they did was they took people's health records, sort of correlated their ACE score with their health records, their health outcomes as adults. Like these are 17,000 adults, not children. And so they found that it was really, really common. So in the original 17,000 people, they found about 2/3 of them had an ACE score of at least 1. Mm-hmm. So out of the 17,000, 67% of them had at least one bad thing happen to them when they were a kid that was identified in the study. So then, like I said, they correlated these health outcomes, and that's the second big conclusion that they got, was that the more ACEs I have, the more likely I am to then have negative physical and mental health outcomes as an adult. So if you look at sort of the major physical health issues that we have in our country, things like ischemic heart disease and breast cancer and a variety of other cancers, things like diabetes, just obesity broadly. A lot of these health problems have been correlated with high ACE scores. And then even things on the mental health side, like suicide, for example, for somebody who has an ACE score of 4 or more, 12 times more likely to die by suicide, or at least attempt suicide, than somebody with an ACE score of 0. And so it has really huge ramifications in that regard. So those were kind of the two big conclusions from the original study. And then over the last 25, 30 years, we've learned a lot more about the mechanisms that are in play under that. So, and I think this is where it becomes really important for just everybody to kind of have this understanding. So when the original study came out, the results were published, the medical community really was kind of scoffed at the whole thing. And the broad response was, bad things happen to you when you're a kid. You're probably going to drink and smoke and have risky sex and engage in daredevil behavior and all these things that are going to lead to these cancers and these other health problems and lead to early death and those kind of things. It was like, well, yeah, it's just bad behavior. That's what we do. Bad things happen. We do bad things to cope. Mm-hmm. And so the researchers told us, well, yes, that's true. That's part of the story. Yeah. But what we've also come to learn is that there's another more important part of the story. And that is that when those bad things happen to us at age, sometimes people don't engage in things like smoking and drinking and other risky behaviors. But even if a person doesn't engage in those risky behaviors, they're still more likely to develop these chronic, serious health problems. So then it became a question of why is that happening? And so what we know is that when we talk about trauma, really what's at the foundation of it, what's kind of really going on in our brains is stress. Mm-hmm. And I think that's a really key word for people to tie into this trauma conversation, because we all have stress, right? It's just part of being human, not anything that we can escape. And so stress is designed to keep us alive. It's about self-preservation. It can help us perform better. I know for me, when I perform a little bit better in my job, when I'm under a little bit of pressure of a deadline, mm-hmm. As opposed to if I can just put it off for a day or two. So stress has this positive element to it, but it's supposed to be temporary and brief. What happens in cases of trauma, whether it's an AIDS kind of trauma or a pandemic kind of trauma, when it happens, that stress response gets activated. So much so that the stress response kind of takes over and really becomes overactive. Hmm. So we know also now too, and one of the things that's been of great benefit to this research is we can actually see brains. We can actually see brains while people are still living. And we can see these overactive stress responses kicking in. So we know that brains really develop and thrive based off of the experiences that they're exposed to. It's adverse childhood experiences. And so when we're exposed to a lot of stressful situations, what we call toxic stress, then our stress response grows, and strengthens, and it thrives right there in the middle of our brain. And so now when I'm, maybe under a little bit of pressure for a deadline, instead of performing well, I actually get really, really stressed out and really volatile and really reactive and impulsive, maybe, and have to react or respond to that a little bit of pressure. So everyone else around me says, this isn't a big deal, but to me, it almost becomes like life or death, right? It's very much about survival and things kicking in. And so that's really what's kind of developed in the research over these last few decades is this role stress plays, and what do we do about that? Like we can't, I can't separate myself from my stress, nor can anybody. We're born to feel stress before we're even born into this world. Mm-hmm. And so it really becomes an important conversations with people, and that's why we want to get this message out. It's really, really important that we figure out ways, not just for ourselves, but for other people, and for our communities, for the groups that we're part of, at our jobs, in our clubs, in our faith communities, find ways to relieve, prevent stress, because that's what's really going on. That's a big conversation I have with people right now with the pandemic, with all the protests and riots that are going on in communities across the country. There's a lot of stressed out people. And when we get stressed out, we know that we become very reactive. Mm-hmm. And it also, another thing that we've learned is that it shrinks our sphere of concern. So that is to say that, Brooke, you have a family and I have a family. But when I'm under a state of constant and serious stress, I'm more likely to just worry about my own family. Mm-hmm. And I'm less concerned, Brooke, about your family and your problems and things that you're facing. Right? It really collapses our sphere of concern inward. And really break through with some of these conversations that we're having. We've got to get past these reactive, stress-based responses.
Yeah. It's really interesting as I personally kind of learned more about this study and dug into some of the research behind it. Two things were kind of light bulb moments for me and things that I'm thinking more about. One is, I'm able to be involved in a lot of different community conversations about various topics, but health specifically. We have a high obesity rate in our community. We have a high rate of depression among our community. And so I can't help but think about the information that you shared and said, we keep trying to address these things now, which we need to. We want to help people. We want to treat them. But what would that look like if we transitioned or also focused some efforts into making sure that our youth and families are supported? So maybe we could be preventing some of these things. Not only would that help the children currently where they are now, but according to some of the information you're sharing, would that also help them be healthier all around later on in life, having a healthier community? So that's one piece I think about. The other piece is, so now what? If children have experienced these things, is this just like dooming my whole life? What are some things that we can be doing for people that have experienced these? Like, how can we help?
Sure. So, there's obviously a variety of specific things that can be done within like a therapeutic context.
Sure.
That's not really what I, try to put forward to people. I think there's broad things that we can all do, no matter our jobs or our backgrounds or our things we make up. It's all something we can all do. And I get it, Brooke. I hear, talking about atheism and it seems overwhelming and, oh my gosh, there's nothing we can actually do about this. But there is. And you're also speaking to, one hand, how do we heal and help people to heal and recover from trauma that's happened to them already? And then also, on the other hand, prevent it from happening again, from happening to other people. And the great news is that the solution is the same for both of those. Mm-hmm. So, Johan Hari has a great book. If people are ever reading it, I highly recommend. It's called Lost Connection. Okay. And it really speaks to why we call this group Connected Together. And what he argues in his book is what we're trying to promote in our community is that a lot of our problems are because we have lost connection with one another. And so the solution, whether we're trying to talk about recovery or prevention, the solution is building and maintaining healthy relationships. And those healthy relationships can be one within a family, they can be one-to-one across groups like me to you, my unit to your unit. It can also be within community contexts, in institutions, in our systems. We have to get people to understand what a healthy relationship looks like, how it feels, to embody those, model them, and encourage other people to embody them as well, teaching them the skills and the things that they need to have them. So that's part of the reason I like people to kind of understand why a domestic violence agency is talking about things like trauma and toxic stress, because obviously we see the solution to domestic violence is healthy relationships, and that's what we want people to do. But we also recognize that healthy relationships is also sort of the solution to other forms of toxic stress and trauma as well, not just violence in the home. Mm-hmm. And so that's broad, and so that's what I mean by everybody can do this. Anybody and everybody can learn how to build and maintain these healthy relationships where we have genuine connection with one another. And it doesn't necessarily, again, have to be in an intimate relationship kind of way, but just in how we engage with each other, as a customer to a business owner, vice versa, or to a client to a service provider, and vice versa. And so, obviously a lot of this trauma-informed care conversation is rightly focused on the service providers and the first responders and the systems and having them respond in ways that are trauma-informed. But we also want to see these skills built amongst informal connections, intimate connections that happen in our homes every day.
Yeah. This is such great information. And, for some people, it's probably the first time they've heard about this. So if there was one takeaway or one thing you want somebody to walk away from, listening to this conversation with, what would that thing be?
I think the big takeaway is to remember that this all has to do with stress. And the way we overcome that stress is by engaging in healthy, genuinely connected relationships, because we are social creatures by nature.
We absolutely are. And this is a particularly challenging time, to maintain those connections. So I think, there's a lot of people struggling with maintaining that and kind of getting that social interaction that they're desiring just as a human right now.
Absolutely. And so, we have to get a little bit more creative right now, I think, in how we connect with people, but ultimately just keeping in mind that particularly when it comes to some of the tough things that are going on around us, we have to engage with each other from a place of kindness and compassion and try to understand. We have to basically short circuit our stress response to get around that, so that we're interacting with one another from a place of kindness and not from a place of stressed out reactivity.
Yeah. Mike, I appreciate your time so much, and I appreciate you sharing your knowledge and your passion for this particular topic. Is there anything else you want our audience to know before we kind of end today's session?
I would just say this: if anybody's interested in learning more, again, you can just go to the CDC website and find information specific to the AIDS study. Also know that my agency, DVI, offers free trainings and presentations and other programs to anybody in the community who wants that information, whether it's about domestic violence or trauma or other various related topics. So you can always just find us on the web, on Facebook, or on Instagram, and reach out, and we'd be happy to have a conversation with you about how a training program might look for your group.
Wonderful. Well, thanks again. We're going to continue this series, and so we'll be back again at the beginning of October to kind of highlight another project that's part of this Connected Together work. So we hope that you'll tune in October. More information will be on our Facebook page. Thanks again, Mike. We appreciate it.
Okay, thank you, Brooke.
Take care.
You too.